All right. Hello, all. I'm doing this my way because I tried to go live on Facebook and tried to share my screen. And for some reason, it wasn't working. It was giving me a lot of technical difficulties, saying that my internet connectivity wasn't good and all this stuff, even though everything was completely fine. So I'm doing this here. You will have access to it unlimited. I'll also post it on YouTube for others to see as well. All right. So, brief introduction. My name is Dr. Kero Abdelmasih. And I can go on and on about my alphabet soup in terms of what certifications I have and what my education was and all this stuff. But I'm just going to start off and say that I'm a human. I'm a human being who is trying to grow every single day. And I truly believe the mantra of if you're not growing, you are dying. And this has to do with ACL rehab for sure. And if you don't have that kind of mindset, it's very difficult for you to get through the day-to-day activities. What I've done here is I've asked a bunch of people. I've asked them, what are your biggest problems? What are the issues? What are you dealing with? How can I help you guys? And the overwhelming answer that I got, actually I got two answers. The number one answer was, the mental game is just so difficult. Like, it's such a long journey. This was my stress outlet. This was my sport. This is my thing to do. And now it's just, I don't have anything. And I can't move. I can't bend my knee. I can't walk. I can't go up and down stairs. I can't sleep. I can't do all these different things. So that was the top answer that I got, that the mental game was just very difficult to navigate through. The second thing that I got was, I don't know what to expect. From the very beginning, I get conflicting answers or get no answers at all from either the physical therapist that I've been seeing or the surgeon or the surgeon's office or people that I've spoken to. Everyone is so different and I just don't know what to expect and what to do. Off of that second answer, I created this document. This document is probably the most comprehensive and detailed document in terms of what to expect after ACL surgery. And it's catered towards people in the first couple, maybe months, a couple of weeks, that kind of thing, and not really down the line. It's more of, what should I expect on this journey once I get surgery? And I feel like this is very important for people, not just who had surgery, but people who beforehand know that they will be getting surgery and want to know what they're getting themselves into. With that being said, I am not going to read my ACL story. I went through an ACL tear myself in high school. It was during basketball tryouts, sophomore year, and it was one of the most devastating things that could have happened in my life. The reason why that was so devastating for me was because I didn't understand what kind of role it played in my life until it was taken away from me. It was my stress outlet. It was my thing to go to. I had teammates. It was my way to be social with everyone. It was my way to fit in. It was all of that stuff. And once that was taken away from me, it was just like, that's it. I'm done. So you could read the specifics about my story and you could read what I went through and kind of where I'm at right now. But the whole point of all of this is not to explain what I went through, but to tell you that I understand you. I feel you. I get you. I understand the fact that you're going through something very, very, very difficult right now. And I want to help you through that through a free, comprehensive document that will explain exactly what you should expect after a huge surgery like this. So please, if you have the time to sit through this entire video, I want you to listen to me. I want you to hear me. I want you to take this as not as, oh, I want to sell you or I want you to message me so that I can sell you on a program or any of that stuff. I just want you to have inner peace in the fact that I know what's going to happen after my surgery. So the first two pages kind of talk about my story. And now we're kind of going to get into the nitty-gritty of expectations following ACL surgery. As a disclaimer, this document should not be used as formal medical advice. I am a sports physical therapist. I treat a ton of ACLs, but this should not trump any formal medical advice that you get because every situation is different. And I don't know the very specifics of your situation. So don't take this as law. Take this as a guideline, a roadmap, things of that sort, so that you understand that this isn't just medical advice that I'm trying to enforce on you. If you have any specific questions, contact your medical team. So your surgeon, your PA, your flight trainer, your physical therapist, the strength and conditioning coach, the people that you talk to in terms of your surgery and surrounding your surgery, talk to them about specifics. But this is just general. Now, there are two types of surgical interventions when it comes for ACL injuries. There's an ACL reconstruction and there's an ACL repair. Okay? The ACL repair, which is the second one, is a relatively new procedure. It has some pretty good studies coming up, and a lot of doctors in the area are practicing this kind of surgical intervention, and they're using it on more and more patients. This is also known as the BEAR procedure, or the BEAR procedure stands for Bridge Enhanced ACL Repair. And basically what they do is they place like a little like cotton thing. It's a scaffold that they put in the middle of the two torn ends of the ACL, and they use a blood supply in order to facilitate healing. Because the reason why is because there is no blood supply to the ACL. There's very minimal blood supply to the ACL. So when it tears, there's not really much that you can do in order to let it heal on its own. Yes, there is some cross bracing and some protocols that are coming out that are saying that the ACL can heal on its own at this time. But I think it's crucial to understand that all this stuff is relatively new and we're still learning a lot about it. Now, an ACL reconstruction is where the surgeon is literally making a brand new ACL for you. They take some sort of tendon. They take your quad tendon, your patellar tendon. They take your hamstring tendon. They take one of those tendons and it becomes a graft. Sometimes they take it from your own tissue. Sometimes they take it from a cadaverous tissue. And that's the difference between an auto and an allograft. An autograft means your own graft. An allograft means someone else's. All right? For the purposes of this specific resource that I'm talking about right here, this comprehensive document, it will focus on ACL reconstruction and not repair. Okay? Even though they're pretty similar, the reconstruction and repairs, and what we do afterwards, I want to focus on reconstruction. Now, in this specific document, I linked what they do during surgery because I think it's important for everyone to know what happens. What do they do? What does arthroscopic mean? What are all these different things? So I linked that there. A disclaimer, there are clips of live surgery, so there is some blood and there is some anatomy and that kind of stuff. If you are squeamish, you should probably refrain from watching it altogether. All right? So down here, I have a summary of what I will be speaking of. I'm not going to go through each of these, but these are kind of the most sought after things and what I've seen personally people ask questions about right after surgery. Now, the number one rule to expect on the top of the page here, top left, is that returning to sports any earlier than 9 months following an ACL reconstruction, it increases the risk of re-tearing up to 7 times. So, if you're trying to get back to sport or any sort of significant competition, anything like, even if you're a weekend warrior, you're trying to get back to sport and just compete on the weekends and that kind of thing, you should expect to be out of that competition anywhere from 9 to 12 plus months. I've had people that stay with me for 12 months, for 15 months, for 18 months. But it is non-negotiable that you go less than 9 months. This, the research has completely solidified on. You do not go back to sport before 9 months. And it's not based on time. So it's not based on the fact that, like, once I hit 9 months and 1 day, I'm going out to sport. No, it's not like that. That is just merely the time-based component that we are talking about here just for your tissues to heal. If you don't have all the functional stuff and you don't pass all the tests, then you don't go out at 9 months. But that is the rule. Now, let's talk about pain. More than likely, you're not going to be in a lot of pain the first couple of hours after surgery. And people will be surprised with me saying that. The reason why that happens is because the surgeon puts in a nerve block so the area is completely numb right after surgery. Once that completely wears off, so whether it's a couple hours, it might be a day or two, once that completely wears off, you will have pain. It will be very painful. It will feel swollen. It will feel like there's a ton of pressure in the knee. It will feel like it's about to explode every single time you move it. That is normal. Sometimes surgeons give these pain pumps where they actually, it's a pump that they attach to you. It goes into the femoral artery, which is down there in the thigh, and they pump pain medications through. As long as that's in, you're not going to feel any pain at all. But once that comes out, you will start feeling pain. So just be aware of that stuff. They prescribe opioids, extra strength Tylenol, some acetaminophen, some stuff to ease the pain. Follow whatever regimen that your surgeon or your PA gives you. I am not a medical doctor, so I cannot speak to that, but I've seen a lot of people who are in a lot of pain because they don't want to take their medications. And I think in the beginning, if you need to take medications, I think you should, according to whatever dosage the doctor gave you. But if you feel like, no, I have a history of addiction, or I just don't want to get addicted to these things, or whatever it is, then you speak to your medical doctor about those things. All right? Now, let's move on to swelling. Swelling in and around the knee is very, 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 very normal. In a lot of these cases, the knee will have bruising. I worked with a surgeon during my specialty training who every single time he would send me a new post-operative case, it literally looked like there was a bomb set off in the knee. And all bruising is these small little tiny vessels that just pop throughout the surgery, whether it's due to pressure or whether they cut through it or whatever it is. Don't worry about that all that much. Even if it looks completely terrible, do not worry. It's fine. All right? Some people will have some swelling in the lower leg and the ankle. That's also normal. Just be aware of those things. In order to control the swelling that you have, you want to elevate the knee above the heart like it shows in this picture right here. All right? Some people are able to tolerate an ice pack around it. Some people, the surgical center gives them an ice pack afterwards. Use those things on the knee in order to calm down the pain and the sensitivities that's there, but also just to improve your overall swelling. It will help a little bit with that. On top of that, when you're in this position, if you're able to do this exercise, which is called an ankle pump, where you just pump your ankles back and forth, like you're pushing the gas and you're bringing it up to your nose. You're pushing the gas, bringing it up to your nose. If you do that, that will also help by using the muscles inside of the lower leg to push the fluid back up to the heart. Gravity will help as well. Doing that 30 times an hour, every single hour that you're awake, is a really good idea for you to be doing these things. All right? So these are really good ways in order for you to facilitate that removal of the swelling. All right. Now, I get a question all the time. What kind of ice pack? What kind of machine should I use? All this stuff. Most of the time, the surgical center provides you one. So they put some sort of like sleeve or gel pack or something on there with attached to a machine, maybe not attached to a machine, whatever it is, and that ices the knee for the time being. But once you're out of the surgical center, or they don't give you anything at all, there are plenty of different options that you can use. Okay? Now, I know that I think Michaela in the last live video, we talked about renting a Game Ready. And you can do that. Game Readies are basically like these sleeves attached to this contraption. It's just a box. You put ice and water in it. And it not only provides ice, but it also provides a compression effect. So that is good, and that's very fancy, but some people can't afford those things. They can't afford to rent that. If you can afford it, by all means, go ahead. If you can't, literally a pack of peas that surrounds your knee or stays on your knee and stays cold will help as well too. So you don't need the fanciest thing in order to control the swelling inside of your knee. All right? Just be aware of that. Do the simple things. The elevation, compression, maybe if you want to. You can ice it. You want to use those ankle pumps in order to push that fluid back up. Use gravity to your advantage. Those are the things that are going to help you with swelling. Moving the knee throughout the day is going to help you with the swelling as well. We'll talk about that later. Now, again, with the ice, just to close this off, the main idea is to get something that can cover your entire knee. Something cold that can cover your entire knee. In terms of the actual dosage of what you're doing it with, you're putting on ice for 15 to 20 minutes on per hour that you are awake. Okay? If you can't tolerate that, you can do it less. That's completely fine. If you can't tolerate 15 minutes, you can do 10 minutes. And that's completely fine. The only concern that I tell people with icing is to make sure that you have some sort of cover or towel in between your skin and the ice pack to prevent any sort of water droplets that may have some sort of bacteria or infection or whatever it is inside of them to go in the open incision. Okay? So make sure that when your incisions are open pretty early on, there might be just a little part that's open. You might get a water droplet in there and it might not have something good in it and then it infects you. And we don't want that. So just make sure that you are covering it with something, some sort of like towel or paper towel or whatever it is. All right? While we're on the incisions, Do not get the incisions wet while they're still open. Okay? Typically 7 to 10 days following the surgery, they're still closing up. They'll close up around, 7 to 10, maybe even 14 days. All right? If you're going to go in and take a shower, make sure that you cover the area with some sort of like taped, plastic bag or sponge bathe, or do something so you can avoid getting water in there. All right? Some people are getting shower chairs in order for them to just be relaxed and be able to sponge bathe and do their thing inside of the shower early on. That's fine. You don't need to do those things. As long as you have some sort of support, a railing, a hand bar, even a crutch to hold, or someone to help you inside of the shower, that works too. Now, your bandages. If the surgical team has given you materials to replace the bandages with, and you're comfortable with doing that, you can change them. Otherwise, wait. Okay? Typically after surgery like that, what they do is they wrap it with a ton of ACE bandages. Then under that, there's like this cloud-like material that you can rip apart. And it's kind of like gauze. They have that. And then they have gauze underneath it. And they have steri strips. And then they have the staples or the actual stitches. And then they have Tegaderm. And then they have all these different bandages that are there. So sometimes to a layperson, it seems overwhelming. When you go to physical therapy eventually, or when you see the doctor next, they will take that stuff off. If you're comfortable enough and you want to take it off on your own, go ahead. Do that. Make sure that you don't take out the stitches, of course, or the staples. Don't mess with any of that stuff at all. Let it heal completely. Let your doctor work with that. I'm just talking about the outer bandages. I wouldn't even touch the gauze at all until you see a physical therapist or a licensed medical professional who can take care of that stuff for you. All right? Now, things to look out for following ACL reconstruction is infection. Infection is one of the number one things we want to look out for. This can lead to some serious trouble, including sepsis. And sepsis is an infection of the bloodstream. So an infection that's traveled into the bloodstream, and that's not good at all, because that has led to death in some situations. Of course, I'm not here to scare you. I'm not telling you this so I can scare you and get all crazy hyperfixated on it. I'm telling you this just because you want to know what the warning signs are for it. Now, the warning signs for it are your knee is excessively swollen. You're very, very swollen and you're painful. So like just a light touch around the knee, just someone poking you, you're like, you're jumping off the table. That's different than the regular pain that you're going to feel. Okay, so differentiate between the two. Try to be objective with that. Okay, so something that wouldn't typically send you over the edge sends you over many edges. All right? It's very red. It's warm to touch, very warm, and the swelling will cause warmth, so don't go crazy if it's a little bit warm, but it's very warm to touch. You start getting things like fever, or there's like pus coming out of your incision, there's like yellow or green drainage that's coming out. You should be on the lookout for that stuff. If you're not sure, if you're like, I see this yellow stuff that's coming out and I'm not sure if that's just the iodine that the doctor put on before the surgery to sanitize the area or whatever it is, if you're not sure, contact them anyway. Tell them, hey, I think I have an infection or something is going on with my knee, and explain to them, and they'll tell you, okay, come in. Typically, they take those things pretty seriously, so they get you in as soon as possible. It's better to be safe than sorry. Okay? Second thing to be on the lookout for is a blood clot, or what we call in the medical world a deep vein thrombosis. This can also lead to some serious trouble. What happens is that after surgery, there is a lack of movement, right? You're not moving all that much. So being sedentary like that, blood starts to pool in the lower leg because you're not using your muscles, you're not walking around, especially if you're non-weight bearing in the beginning. It starts to pool and it creates this like clot, okay? And that clot, if it dislodges from the leg and it goes up the leg, it can actually travel towards the lungs. And that can be fatal because it can get in the way of your breathing. Okay? So, signs for a deep vein thrombosis are blood clot or excessive swelling, very painful to touch. And I'm talking about like the calf area, not really like the quads or the knee area. You're very warm to touch, you just don't feel right. Like it feels way different. It's not just the pain or the sore feeling. It's kind of like, like this sends me off the edge too. In order to remedy this and make sure that stuff doesn't happen, doing the ankle pumps every single hour you're awake and elevating will reduce the likelihood of this. So make sure that you are doing some sort of exercise with all of it. Cool? Next, range of motion. Let's get terms straight, guys. Extension is straightening the knee. Flexion is bending the knee. Your main priority after surgery is extension, which is straightening the knee. Flexion, if you do absolutely nothing and you just let the knee relax from all its swelling, flexion will resolve. It will get better. You will have more range of motion over time. Of course, that's not me saying don't do anything. I'm just saying that if you don't do anything, flexion will resolve. Extension will not. It will not resolve on its own. So it's very difficult to come back from extension, then flexion. Make sense? So make sure that your main priority after surgery is extension. Exercises to improve your range of motion should begin as soon as the day of surgery. Day of surgery. Do you hear me, people? Should I clap it out? Day of surgery. If you're too groggy and you're tired and you're painful and you're all these different things, then wait till the next day. And of course, be aware of the restrictions that the surgeon gave you. So if the surgeon did a meniscus repair, again, we're talking about strictly just ACLR, which is ACL reconstruction. They just work on the ACL. If they do a meniscus repair, they will tell you to be non-weight bearing, which means you can't weight bear on that leg because they put stitches inside of the meniscus to repair it. And they will also tell you don't bend your knee past a certain amount, 80 degrees, 90 degrees, whatever it is. If you have those restrictions, make sure you adhere to them. But if you don't have any restrictions at all, you should be moving as soon as possible. I have had people literally have surgery in the surgical center and come up to me in my specialty training like a couple hours later. Literally right then and there. So make sure you are doing it. Okay? Now, the exercise list. This is what a lot of people are like, yo, give me, I need this, I need no exercises. I'm going to keep this as simple as possible. Flexion, which is bending the knee. If you have a meniscus repair, just like I talked about, and have a movement restriction, do not bend the knee past 90 degrees. That's typically what the restriction is. Some surgeons will tell you, yes, you had a meniscus repair, but you don't have any sort of restriction. So just make sure you ask, or they say it on their prescription, or you ask your physical therapist, or whatever it is. 2 exercises here: seated assisted knee flexion and the assisted heel slide. Here is the actual video once you get the document. And then here's the dosage, how long you should be doing it for. All right? How often, what the duration is, all that stuff. Now, the extension, which is the main priority after ACL surgery. The biggest thing is to work on this heel prop exercise, which again, there's a video linked in there. Putting a prop underneath your heel, nothing underneath the knee. You never put anything underneath the knee, like a pillow, especially when you're sleeping or anything like that, especially when your brace is off. The reason is that your tissues are scarring up. Okay? After surgery, what it's going to do is that if you put a pillow underneath your knee is going to naturally fall to the curvature of the pillow, which is in a little bit of flexion because it's more comfortable. And then what's going to happen is it's going to start scarring up. And then it stays like that. Now you can't extend. You cannot. Now early on, you can fix that very easily. Research says up to 12 weeks after surgery, you can still work on these things because your tissues are pretty pliable. After 3 months or 12 weeks, it's difficult, very difficult to get that extension range of motion back. So work on it early. Okay? So you're not putting anything underneath your knee. You're putting something underneath your foot and then just letting the leg drop. The knee drop. Gravity helps it. Okay? At first, you're not going to be able to tolerate much, maybe 1 minute, 2 minutes, not a high heel prop at all. But eventually, you want to be able to increase the time as you get a little bit more comfortable. You will have discomfort with this. Yes, you will have 3, 4, maybe even 5 out of 10 pain with this. Discomfort. But, try to push it a little bit longer with these things. Okay? You want to do this 2 to 3 times every hour you're awake for the amount of time that you allot. So if you do it 2 minutes, do it 2 minutes a couple times an hour and do that every hour you're awake. Keep pushing. 3 minutes, 5 minutes, 10 minutes. Again, if you have restrictions, like there was a meniscus repair, they may not want you to get into hyperextension moments. So just make sure that you're aware of those things. Okay? And the third most important thing is quad activation. Another exercise here, just a quad set. All physical therapists know this. It's all the simple stuff. I have included tips like tapping the quad can help with activation. Using things like NMES or electrical stimulation where you have those sticky pads on your thigh and it shocks the quad. You can use those things as tolerated as well in order to help. Icing the knee has shown to decrease a little bit swelling, and less amount of swelling that you have, the more ability for the quad to contract properly. And this is all a mind-body connection thing. So just make sure that you are trying, your intent is to try to activate the quads as much as possible. And on my Instagram, at Kero.dpt, I have a ton of different videos that show these things, straight leg raises and what a proper quad set looks like and quad activation and things like that. So be sure to go over to Instagram and follow me there. Now, let's go over to the types of knee braces. You have two different kinds of immobilizers or braces that typically surgeons give you. They have this one, which is the floppy, just like put a ton of straps over, Velcro straps. They put you in that thing. A lot of the time surgeons give that and they're like, oh yeah, once they have proper extension and their quad is activated properly and they're able to kind of walk and do those things, then they can get rid of that brace. So they wean them off. The hinge brace is a little bit more involved. It's more expensive. It is that where it has, there's a hinge there that you can lock and unlock, and it allows you to go into either knee flexion or knee extension. Okay? The knee brace is used for two reasons, like I just explained. Number one reason why you have a knee brace is to keep the knee extended. So when the brace is locked, that means they want to put you in that straight position so you don't bend at all, so you don't have that scar tissue scar down, and then you're stuck in this flex position. They want you to be as straight as possible. That's why they put you in that brace. Second reason why they put you in that brace is because your quad is very weak early on after surgery. So the brace actually stabilizes your leg while you build the quad strength. And any good physical therapist is supposed to walk you through step-by-step processes in order to get rid of the crutches. Not just, oh, okay, get off. You're good. You have good quad strength. No, it should be a progression. 2 crutches to 1 crutch. Work on walking in physical therapy. Talking about short distances and longer distances. Those are the kinds of things you should be working on with your physical therapist. Now, some surgeons will prefer no brace at all. I've seen surgeons who just don't want a brace at all. But all these principles still apply. Again, it's about the principles, it's not about what they do. You want your knee to be straight, you want your quad to activate and to become stronger. I give you these braces just as support and not as the end-all be-all. Now, let's go through the weight-bearing statuses. There's 3 different kinds of weight-bearing statuses. There's weight-bearing as tolerated, WBAT. And you can bear as much weight as you are comfortable with on that surgical leg. That's weight-bearing as tolerated. Non-weight-bearing, NWB, is don't bear any weight at all on the surgical leg, at all. Don't do it. Some surgeons will be like, because of their meniscus repair, or even without a meniscus repair, be like, I want you non-weight bearing for 2 weeks, 4 weeks, 6 weeks. Adhere to those restrictions, please. And partial weight bearing is you're bearing some of your weight, 25, maybe even 50% of your body weight on the surgical leg. Okay? And here I've attached 2 videos on how to use the crutches while walking and how to use the crutches to navigate stairs. These are very important. Check them out. Right? Like I said before, this bottom part right here, do not get rid of the crutches quickly. Do not rush that process. Do not. Why? Because your body can start to build compensatory patterns if you're not strong enough. And if you build compensatory patterns, that will down the line affect you. You won't be able to activate your quad as well. You'll start to get your knee stuck into flexion instead of full extension. You'll start to walk all funky, all these different kinds of things. There should be a progression that your physical therapist walks you through. If you rush it, bad things will happen. Cool? Sleep. In the beginning, it's going to be very uncomfortable to sleep. This may take a couple days, it may take a couple weeks, it might even be into a month or 2. That depends on your own pain levels and your ability to control those pain levels and be able to get in a comfortable sleeping position. Some people buy all these oblong crazy pillows off Amazon because they're more comfortable like that. Great. Again, if you do not have a brace or your brace is unlocked, do not put a pillow underneath your knee while you're sleeping. Because imagine 8 hours of you stuck in this position right here. When you wake up in the morning, you will not be able to get it straight. I'm telling you from now. Do not. I've seen people that are stuck here. And I can't force them out of it. I can't. If your brace is locked, and it's locked completely straight, then that's fine. Do whatever you want. But just make sure the brace fits well and it's on properly and all of these different things. I would say just avoid having a pillow underneath your knee altogether. Right? Remember, keeping your knee straight is a priority. Extension is a priority. Sleeping for 7+ hours a night with your knee in a slightly bent position will hinder any progress that you've made in order to straighten out your knee, because now you're flexed your knee for 7 hours. It's this concept of what we call low load, long duration. So it's slightly bent, stays like that for 7 hours. When you before tried to keep it in this position for 2 to 3 minutes at a time, for a total of 20 minutes throughout the day, 30 minutes, 40, an hour, whatever it is. That 7 hours trumps that 1 hour. So you will be stuck in this position for a very long time if you don't adhere to that. All right? Physical therapy. Depending on the surgeon, PT may begin the day of, may begin the day after, may begin 2 weeks, it may begin 4 weeks after. Every surgeon is completely different. Research does support you getting into PT as soon as possible. If you can't do that, then start doing these exercises as soon as possible. Of course, bearing in mind whatever the surgeon's restrictions are. Now, this is a plug for me and whatever remote coaching options there are out there. Since COVID, life has changed drastically, right? Of course, there were certain urgent medical things that needed to be seen, but sometimes things weren't as urgent, and then people got stuck in their homes. So people like me, I've created a program, a business, remotely to address all of these issues. So if you feel like you're stuck and you're like, I don't know what to do and I can't get into physical therapy and all this stuff, consider remote physical therapy. Consider remote coaching options. And I'm more than willing to have a conversation with you about that stuff. All right? Now, last thing I want to talk about is the mental game. This is one of the most underrated aspects for ACL reconstruction surgery and its recovery thereafter. All right? If any person, your mom, your dad, your uncle, your cousin, your best friend, a stranger, it's a person on Facebook, comes up to you and says, ACL surgery is not that big of a deal, I give you permission to punch them in the face. Full permission. Why? Because ACL surgery is such a big deal. It's huge. It's one of those injuries where it's like when you watch professional sports, football, cheerleading, soccer, male, female, doesn't matter who it is, they go down, they have an ACL injury, and everyone's just like, no. Season ending. It's career ending for some people. So this is a big deal. It's a big deal. If someone says it's not a big deal, then they don't understand the process themselves. Okay? Now, I'm not a mental health expert, but within my program, I try as much as possible to touch on this mental game because I know it's so important. Because remember, I told you the two things that people told me the most were I don't know what to expect and the mental game. The two biggest things that people don't know how to address with ACL surgery. I've attached here a bunch of different resources by different people, male, female. Some are podcasts, some are courses, some are free, some are paid, some are whatever it is. Check them out. Because this will help. This is what's going to help you through all of this stuff. And no, as a disclosure, I don't have any incentives or formal affiliations with any of these people. I know these people and I know they're good. And that's why I give you these resources. Okay. I think there's one last thing that I want to touch on that I've been getting a lot recently is that the numbness and tingling that people get after surgery, when the surgeon cuts through the knee, whether it's a small cut or a big cut, whether it's to harvest the graft or to just get into the knee joint itself, they will cut through very small nerves that are sensory nerves, which means they have nothing to do with your function of moving. They just have to do with sensation. So they cut through that, and sometimes people will feel numbness or tingling maybe on the inside, maybe on the outside of the knee. That's very normal. Some people over time, it will come back, that sensation will come back. Some people, it won't. But it's a very small area, and you shouldn't be concerned if this happens. So if you get that numbness or tingling on the side of your knee, it's a small area, and you're like, I can't even feel this, and it's like 2-3 months after surgery, that's normal. especially when you're trying to like kneel on the floor and do some bending exercises and that kind of thing. Very normal. This document was made for you. I heard you, I listened to the problems of the people, and I created this document in order to help you, to serve you. And if you feel like you need a little bit more, you're like, I need some more coaching, and you want to work one-on-one with me, let's talk. Okay? I've had a lot of people come to me and ask me, hey, can you see this? Can you do this? Can you do that? And I have a conversation with them. Some people I'm like, I don't think this is going to be a good fit. Whether it's personality, whether it's psychographic profile, whether it's whatever it is. Just understand that I'm here for you. I offer both remote coaching, so any state, any country, wherever you are around the world, I offer that. And I also offer in-person formal physical therapy services in Princeton, New Jersey, if you're local to the area. Okay? I have a very unique model, and even if you just want to discuss what my model is and how I help people and what I do, hop on the phone. Let's talk. DM me on Instagram. How to contact me? DM me on Instagram is probably the best way for you to contact me. If you're really serious and you're like, I'm gung-ho, I'm ready to go, call me on my business line. And the number is there, 908-912-6810. And we'll have a conversation. But the first thing I want you to do is I want you to follow me. I want you to understand who I am. I want you to trust me. Because like I told you in the beginning, I'm a human. I'm a human that went through all of these different things. And if I haven't said it before, what I do now is I own my own business specializing in ACL injuries. Specializing in that stuff. The reason why is because I've seen the system. I've worked in hospital systems. I've worked in cash-based systems. I've worked in insurance-based systems. And it seems like the model is so broken. And I want to clear that. I want to get rid of that. I want to be able to give real advice and change people's lives. Like, you come into this, I don't want you just to get better physically. I want you to realize that this exposed so many things in your life, and now you're just going to explode. And that's why I tell people that I empower individuals with ACL injuries to live a life of I can. I can. You can do it. You will do it. You just need the proper support. You need the proper resources. And you just need to have a mindset of, let's do it. That's all I need. So, follow me on Instagram. DM me with any of your questions. You can call me at any time that you want. I want to speak with you. I want to hear your story. I love getting connected with people who have these different kinds of stories. And if you're not a good fit for my program, I will make sure to find a resource for you that will be helpful for you. Cool? Alrighty, guys. Peace.